The CDC said the first people to get vaccinated for COVID-19 would be healthcare workers and residents in nursing homes.
News 15's Princess Janae Steverson-Lowry explains who might be next in line to get vaccinated.
COVID-19 vaccinations have been approved for healthcare workers, nursing home residents, politicians, and emergency use. But as the deadly infectious virus continues to surge throughout the world and in our area, many people are wondering, when is it my turn to roll up my sleeve and get vaccinated? The answers to that question will vary from person to person, and it starts with 3 factors. The first, what does your health look like? Due to vulnerability of hospitalization, illness, and death, the CDC says next up is people 75 and older. One Louisiana lab tech offers her thoughts.
We have to think about the people who are the most vulnerable, and right now that's older people with underlying conditions. So I think it makes complete sense that they would be the ones to get the vaccine first. And I would actually argue that anyone who said otherwise was in fact being selfish.
The second factor, what is your job? The Advisory Committee on Immunization Practices says those who work in education, childcare, food and agriculture, manufacturing, corrections, the U.S. Postal Service, public transit, and grocery stores will take priority.
You know, they're on the front lines of healthcare, but we're on the front lines at work. Less so me, because I work in a lab that's a little more, I can control how, the influx of people and stuff like that. But people who are working at grocery stores, we can't shop without them.
The third factor is based off of where you live, because each state will handle how the vaccine comes out differently. ACIP says, in the meantime, monitor your state health department's website for specifics.
States have mostly led the efforts for, when you talk about testing, that was done on a state level. So it makes sense to me that the vaccine would also be done on a state level.
ACIP believes that the public may start getting vaccines somewhere in May. At the end of the day, supply and demand will be the driving force for vaccine distribution. Now, when it comes to decision making at a state level, it will be ultimately left up to the state governors. State governors are expected to be provided with recommendations from their health and preparedness agencies. In Lafayette, I'm Princess Janae Steverson-Lowry, News 15.
The CDC says after frontline essential workers and seniors 75 and up get the vaccine, next should come people aged 65 to 74, younger people with underlying medical conditions, and other essential workers.